Hi, do you own a pharmacy and want to increase your visibility to more clients? Well, it is time for you to go digital. Subscribe to the Medsearch Zambia app and let us help you increase your visibility not only to clients in your area but across Zambia. With the Medsearch Zambia app, we'll help patients or clients know where you're located, what services you offer, and what medication you have. This helping people now know more about you. Come on board, let us help you increase your visibility. Like what we say, Medsearch Zambia, healthcare simplified.
10, not more than 9, 10.
I don't know why it's refusing, eh?
It's Parkinson's. It's got Parkinsonism.
It's slow. It's got Parkinson's.
Really? Like that's what? That's a medical joke, huh? You're alive.
You see what?
What a good way to start, eh?
Okay. Okay, wait. All right, Zanga. It's just a medical joke. It's a Parkinson's thing.
Yeah.
Okay, so Zanga tells me that we are live on Facebook on our Medsearch Zambia page, and I trust him completely about such things. Other things, yet to be determined. Anyway, I am Dr. Mataa, Moses Mataa from Medsearch Zambia, and this is your Medsearch Zambia Health Talk. I know you're all used to having us with you on Fridays, but today we thought we'd have it today, looking at the fact that we're going into a long weekend and we want to catch as many of you as possible before people travel around the country and get up to all sorts of things. It's important that we remind you about your health, and that's what Medsearch Zambia is about. It's your mobile health directory that tells you where you can find health-related services. Today, we are very privileged on Medsearch Zambia, not just because I am here with my good friend Zanga Musakuzi, who is in the background, but today we're joined by a friend, a colleague, Dr. Lorraine Chishimba. Dr. Chishimba is a neurologist currently working at the University Teaching Hospital as part of the neurology unit, a team that I have had the privilege of working with over the last couple of years. And we invited her here specifically because Dr. Chishimba has a very strong interest in movement disorders and especially Parkinson's disease, which is the topic of today's discussion. So Medsearch family, please welcome Dr. Chishimba to our platform. Hopefully we'll get to see her many, many more times after this. Dr. Chishimba, you're welcome to Medsearch Zambia.
Thank you. Thank you so much for inviting me. Yeah, I'm looking forward to the discussions today. This is my first time joining the program, so I'm excited.
Yeah, thanks so much for sparing the time. So I guess we'll jump right into it. So Parkinson's disease, people may not know, so that's why we're having the talk, that the 11th of April is actually celebrated as World Parkinson's Day. And it's a day that is meant to highlight everything around Parkinson's, to bring it to the attention of people who are caring for persons living with Parkinson's and just the general community. In fact, the whole month of April is celebrated as Parkinson's Awareness Month, and then it culminates on the 11th of April with World Parkinson's Day. So as Medsearch Zambia, this entire week, we've been running information about Parkinson's, and we like to end these weeks with having just an expert in the field to come and talk to us and all of our followers, people who have an interest in health, and to learn more about that particular condition. So today we'll be talking about Parkinson's. So I guess the first question for you, Dr. Chishimba, Lorraine, would be, I may have heard about Parkinson's disease, but I'm not sure what it actually is. So how would you explain Parkinson's disease to Zambia? What is Parkinson's disease?
All right, I will try as much as possible to say it in a clearer manner. So I'll start with maybe a scientific way of putting it. So this is what we term a neurodegenerative disorder. What that means is like a combination of two words. So we have neuro, that has to do with the brain, and then degeneration, that has to do with a dying away or some sort of death or breakdown. So Parkinson's disease is a disease which is characterized by a breakdown of a certain portion of the brain that is known as the basal ganglia. So the basal ganglia is important in our brains in sort of coordinating our movements, making sure that we're not making too much movements, and also making sure that our movements are not too slow. So it kind of modulates our movements. But there are neurons or parts of that organ in the brain that sort of die down or die off. There's a chemical that is used known as a neurotransmitter, which breaks down because the neurons responsible for producing it are affected or they die down. And so it stops functioning properly. And therefore, it makes someone to develop Parkinson's disease. And what you will normally see is somebody becoming very slow. Remember, I talked about the fact that the basal ganglia is responsible for making sure that your movements aren't too slow. So the person will be very slow, but at the same time, they'll have these extra movements, particularly a tremor. So when they shouldn't be moving, when their body parts shouldn't be moving, they are at rest, they will exhibit a tremor. They'll have a hand that is just shaking. In fact, the person who this condition is named after, his name was James Parkinson's. He wrote a book or an essay about this condition that he noticed in people who had these characteristics of the tremor. And so in a nutshell, that's what I would say is what Parkinson's disease is.
Okay, great. So just to kind of see if I got all of that, and you and I, obviously, because we work in the field, we know all these terms and everything, but for someone who is not in the medical sector, I think one of the ways I like to think and explain about Parkinson's is the human brain is it's a very wonderful, complex organ that does so many things. Me just moving my hands like I'm doing them now involves so many little processes. There's a part of my brain that controls movement, fine movement, so that I just do this because I want to do this. And if I have problems in certain parts of my brain, like the basal ganglia that you talked about, then I begin to have problems with movement. Parkinson's is just one type of movement disorder where I kind of slow down, but there are a lot of other movement disorders, which we won't really talk about today, where it's the opposite, where someone starts to move too much. So if I have a problem with a certain part of my brain, then I may start to show symptoms of abnormalities of movement. And in Parkinson's, it's a slowing down. Do you think that's kind of a fair summarization of a very simplified way of thinking about Parkinson's?
Yes, that is very simplified. In a nutshell, there is a slowing down of movement. So for example, just the simple facial expressions, you and I can easily smile, can easily make all these facial movements when we're interacting with other people. You find that someone who has a Parkinsonism, all of that is kind of slowed down. And so they have a face that looks like they're wearing a mask. They might be quite excited, but they just don't show these expressions. And this is not because someone is upset, If they want to take a step and they find that they struggle to just make that step and move. So they become quite slow over time. So I think that's in a nutshell, that's a very basic way for us to understand it. But another important component is the tremor. Not everybody might have the tremor, but it's part of the core that makes the diagnosis for Parkinson's disease. So yeah, the slowing is a big one.
Yeah, actually wanted us to talk about the tremor a little bit more, because it is one of the classic, when you think about Parkinson's, it's one of the classic symptoms that we think about, this tremor. And this tremor is just shaking. And so the question would be, is tremor always there in Parkinson's, or are there people who have Parkinson's and really don't have tremor as a big part of their symptoms?
Yeah, there are people who may not have the tremor and they still have Parkinson's disease. So I think what we've highlighted is the slowing of the movement. That's like the foundation, if I can put it that way, of Parkinson's disease. There is a slowing to the movement. And so with the slowing, some people have the slowing plus the tremors. And then some people have the slowing plus what we call rigidity. They're just rigid about their movements. And I wanted to say very quickly here that we're not talking about a slowing that would have resulted from something like a stroke, because even someone who has suffered a stroke might become slow. And we're not talking about the slowing which can result from someone, say, who is depressed and they're not interested in activities and they're just slow. This is something which happens very slowly over time, has nothing to do with an injury to the brain or a stroke or some infection that has left you impaired. This is just something, like I was explaining earlier, that just develops in somebody, and then they start to exhibit Parkinson's disease. And I don't want to say too many things, but at the same time, I want to say that whilst we're talking about Parkinson's disease, there are also other types of what we call Parkinsonism, which are just trying to say that there are other conditions where you might suspect someone to be having Parkinson's disease, but they're not really related. It's just someone who is exhibiting some slowness. But Parkinson's disease is really just the slowing plus either the rigidity or the slowing plus the tremor. So it's not everybody who's going to have a tremor. So we always look for a slowing in movements for us to make the diagnosis of Parkinson's disease.
Great. I know we spent a bit of time on tremor and slowing, and those are very important symptoms. But are there other symptoms that maybe even come before someone starts to show tremor or starts to show slowing? Are there certain things that people with Parkinson's may have been complaining about or experiencing long before they develop the tremor?
Yes, so we like to say motor, that is the things that you see, the slowing, the tremor, and then we say non-motor, other things that may not necessarily look like part of the slowing. And indeed, it's been shown over time that a person will not just have the slowing or the tremor or the rigidity, but they might also have other problems such as constipation. As you can imagine, even the bowels become slow. They might have problems with the sense of smell. And these can occur in someone even like a decade or so before they begin to exhibit the slowing and the tremor. Some people will have, it's part of the spectrum. These vivid dreams, what we call rapid eye movement behavioral disorder. So they act out their dreams, for example. When they're sleeping, they act out their dreams. And so you will hear, you usually ask the partner, the person that they sleep with, who's going to either endorse that, when this person is sleeping, they will be shouting, they will be kicking, because during their sleep, they're having this, the brain is not suppressed enough for it to avoid you doing all these activities. So those are the key ones, the constipation, the difficulties with the sense of smell, the acting out of dreams, There are many other things that have been documented, a general apathy. For some people, they might have that like so many years before they begin to appear slow, or so many years before you see the tremor. And then it will carry on even through the time when they are living with the easily identified things like slowing and tremor.
Right.
And I wanted to say something about the tremor. Sorry,
Sure.
I just wanted to say something about the tremor. So the typical tremor in someone with Parkinson's disease is what is known as a rest tremor. That is a tremor that's occurring when someone is at rest. So they're not picking up a cup of tea. They're not, handling anything. They're just sitting down and resting. And you find that they develop this tremor. It's different from other tremors which have to do with action. So there's another whole type of tremor where when you become nervous, you are shaking, or these people will talk about, when I'm trying to make a cup of tea, that's when I shake a lot. So it's not that Parkinson's disease, the tremor in Parkinson's disease is not that kind of tremor. We always say it's a tremor that is at rest. That's not to say that the person with Parkinson's disease cannot have a tremor that will occur when they're doing something. But I think what is quite typical about Parkinson's disease is that the tremor occurs when they are sitting and relaxed and at rest. It might even disappear when they start to do something.
Right, so they'll be sitting at home with their family, very, very comfortable, and will notice just a shaking.
Yeah.
They may notice it, a family member will notice it.
Mm-hmm.
Yeah, so resting tremor. So not a tremor that it only comes up when they're trying to do something, but when they are at rest. And is it always just the hands, or do other parts of the body also, can they also have a tremor?
Yeah, so the tremor usually involves the limbs, that is the arms, and it can also start in the legs. A tremor that starts in the head is very unlikely to be Parkinson's disease. So in the movement disorder field, they say that a head tremor should not make you think of Parkinson's disease. That's likely some other condition. So for Parkinson's disease, the tremor is usually involving the upper limbs, the hands, or the legs. In fact, if it starts, you have the tremor, you're sitting down and you notice someone having a tremor in the leg, the first thing we think about is Parkinson's. So yeah.
So we were talking about that it can take 5-10 years from onset of Parkinson's to full manifestation of symptoms. So this is not an acute thing. This is not something that happens over hours and days. This is a really, really long disease process, which brings to mind the question in terms of, are there risk factors that put people at particular risk of developing Parkinson's in life? Are there things I should be doing or should not be doing that can potentially influence whether I end up developing Parkinson's or not?
Yeah, so to answer that question first, we have to state that the reason for Parkinson's isn't very clear, even though there's a lot of science that has gone in to understand the process of developing the disease. But as to what really causes, why do those neurons start to die down, there really isn't any clear-cut cause or solution. What they have established instead is that some people develop Parkinson's disease because of some of the genes that they carry. And these genes, you may not necessarily be carrying them because your parents had them. It's not like they're being passed on to the family. So you might have certain genes which then mutate, they change their nature, and that puts you at risk of developing Parkinson's disease. So there's a genetic component to that. And then they also extrapolate to say there's also an environmental aspect to the development or that it may lead to Parkinson's disease. So they've shown some links, if I can put it that way, some links. We can't really say this is the cause, like, you ate this and then this is the result, but they've shown some links. So for example, they've shown that people who would have, like one of the risk factors is being exposed to pesticides. And they show this link because they notice that among the majority of people who will have Parkinson's disease or who have been diagnosed with Parkinson's disease, you find that one of the common denominators among those people is that they would have been farm workers exposed to certain pesticides. Well water use, for example, they find that people who live in rural areas, there's a link between rural living, for example, and Parkinson's disease. And again, this is, the link is made because they notice that one of the other common denominators in people who have Parkinson's disease would have been that, oh, they lived in a rural setting. And the link there is that, the thought is that when you live in rural settings, you are using, say, well water, some of the chemicals that seep into the ground, because you usually have to use, well water will seep into the ground, like your chemicals from pesticides and that sort of thing might seep into the ground, and then you drink that water and that puts you at risk. So all these are just what are known as risk factors, the environmental issues. There's been thoughts that maybe having been exposed to certain particular viruses could lead to Parkinson's disease as well. But there isn't really a true non-risk factor. So in a nutshell, we can say genetics, having certain genes that mutate, and this doesn't have to be something passed on in the family. And two, the environment. So rural living, exposure to farm products, particularly pesticides, exposure to well water, rural living, those are the things that they have seen to be the link to someone developing Parkinson's disease. And I say this bearing in mind that here in Africa, we don't really have the data to show what will make our population develop Parkinson's disease. So this is information that has been researched in developed countries, and then we extrapolate it to the rest of the world, if I can put it that way. But I think over and over, or rather, overall, these are some of the links that have been made with Parkinson's disease. And then when it comes to protective measures, again, they have made these links, but they're not really clear cut to say, let me do this, and then I will protect myself from getting Parkinson's disease. It's quite difficult to predict who can get Parkinson's disease, even though we have talked about the risk factors. When it comes to protective factors, again, they have shown certain characteristics. So for example, they'll talk about smoking tobacco, and yet that it's protective in people with Parkinson's disease. But we know that tobacco will probably kill you before it protects you from getting Parkinson's disease. And the link there is simply because it's a very complex link that they've shown. Some people think, no, it's not really that tobacco or the nicotine protects you. It's just that people who tend to develop Parkinson's disease are also, their makeup is such that they are not excited enough or stimulated enough to nicotine, and therefore they will never take it in their life. So it looks as if, tobacco was protecting, tobacco use was protecting a set of people, when the link is a bit different. Then other people have talked about the intake of coffee, that, they've shown that people who take a lot of coffee, or rather, you find that a lot of people who have Parkinson's disease, when you look at their background, you find that they didn't take a lot of coffee. So it's those types of links, if I can say it that way. But we can have a longer discussion on these things and see if this is the way we would want to go. Clearly, you have to be wise in the decisions that you make. Other people have talked about alcohol being protective. So again, all of those sort of questionable, but it's called science. But yeah, I can't really say that there's something you need to be doing that is going to protect you from Parkinson's disease, just because I don't think we can predict who can develop Parkinson's disease.
Maybe just to jump in, Dr. Mataa. Now, I think during the course of the week, as we've been interacting with many people, are you getting me?
Yes.
Okay, so last week we were looking at binge drinking and alcohol behavior here in Zambia. And when we talked about tremors this week, one person had asked a question to say, is there a relation between alcoholics who reach a point where even if you tell them to stand still, they will not be able to stand still. They'll have that shaking. Is there any relationship? Can they later on, are they more at risk to have Parkinson? That was one of the questions that we had during the course of the week. So I don't know if, maybe I'll bring it back to the discussion. Is there a link between alcohol abuse and Parkinson?
Yeah, good question. So if you follow the discussion, what I was really saying just a while ago was that what has been shown actually is that alcohol is protective. And now I'm not saying let's go out there and drink our lives. I even fear to say this, but but then here's the thing. So like I said, it's a bit complex. It's not as straightforward as it sounds to suggest that alcohol is protective, okay? There are many people who don't take alcohol, who don't suffer from Parkinson's disease, you understand? Then I also wanted to talk about the tremor. So we need to know what kind of a tremor someone who has alcohol has. Okay, so we characterize the tremor that is found in Parkinson's disease to be a tremor that is at rest. And we know it's not related to alcohol. The person who has been alcoholic, the type of tremor they would tend to have might be a little bit different. So one has to evaluate what kind of tremor, listen to the history, do a physical exam for us to know what sort of tremor you're dealing with or you're talking about. I don't know if Dr. Mataa has any comments as well, but this is what I would say. I think it would be a bit rash for us to say that the tremor that is in alcoholics is the same tremor that a person with Parkinson's disease might have.
Yeah, I would just agree with you, Lorraine, in terms of there are many different types of tremors caused by a lot of different conditions, and the tremors in people who abuse alcohol and are dependent alcohol, those are because of the dependence on alcohol. It's also because there is an effect on a lot of the similar areas of the brain, basal ganglia, your cerebellum, all of which are involved in how we walk and balance and how we move around, but not that necessarily if someone has tremors because of alcohol later on in life, they are more at risk of developing Parkinson's. And just to reiterate what Dr. Chishimba is saying here, we're not saying that alcohol is protective against Parkinson's. That is not what the science is saying. It's not clear cut. So please, Zambians, we know you. Behave yourselves.
Yes.
Do not start quoting us that we heard on Medsearch Zambia that alcohol protects you from Parkinson's. No, that is not what we're saying. And it's a field that we're still learning quite a lot about in terms of what causes it, what the actual mechanisms are their potential risk factors. And that's the beauty about science. We keep learning new things. We keep learning and we keep adapting. I actually want to bring us back a little bit, Dr. Chishimba, to something that you said earlier, where when we're talking about things like, again, risk factors and everything, one of the comments that we tend to hear with conditions like Parkinson's is that these are not diseases for Zambians. These are diseases for other places.
Yes.
for for high income countries,
Yes.
for certain races, that we do not have diseases like Parkinson's in Zambia. But then I'm listening to you talk about some of the things that we think possibly can contribute, like living in rural areas, like using well water. And in all honesty, that's probably 60, 70, 75, 80% of Zambians. So I guess the question is, do we actually have Parkinson's disease in Zambia?
I think
From your practice, from your experience, do we actually have? Yeah.
I'll jump on that one. I think most of the time when we are talking about a condition, it's within one day people are able to relate to it. But this week has been, I think, we spent 2 days trying to explain what Parkinson is, because majority of the people would say, no, we've never. That is why most of them would bring in the alcohol part, because majority of them do not even know to say, do these conditions really exist in Zambia? I thought these are conditions that if you're a medical person, if you're a student, you would only think, I'll never say it in Zambia. Let me not really pay attention in studying about it. If you're a layman, it is not something that you're able to even waste your time learning about it. Like, I'll echo the question that Dr. Mataa, is this a condition that we're having in Zambia? Is it one of the minority or one of the 2.8 million diseases that we have?
Yeah, very interesting. No, the fact of the matter is there are Zambians with Parkinson's disease. Okay, so like I mentioned earlier, we have a lot of research that comes in from outside Zambia, and that could be part of the reason why we don't have our own sort of data to state how much of the Zambian population actually gets affected. Okay, but I can tell you that from the information that they have gathered around the world in these so-called high-income countries, and even within part of Africa, there's been some data that has been collected, but just not as much as in the high-income countries. So they estimate something like maybe 100 to 200 people per 100,000. That's, to break it down, that's like 1 or 2 people per 1,000. Okay, that's what they estimate globally. Here in Africa, we don't really have the data, but I can assure you that we do have people with Parkinson's disease here in Zambia. The problem, I think, which I have seen is, okay, one, we're talking about not having enough research, but two, I think we have a lot of misconception and a lack of knowledge about what Parkinson's disease is. So for example, already you're talking about a tremor that we see in someone who is alcoholic. And yet, I think from the onset of the program, we've established that the foundation, if I can put it like that, I hope it helps, of Parkinson's disease is the slowness. Okay, that's a big one. You can't make a diagnosis of Parkinson's disease minus the slowing component. So a lot of people, and again, the other thing is most people, the majority of people that get affected with Parkinson's disease are older. So people in their 60s going up, all right? That's not to say we don't have younger people. There are young people. Just this morning, I was seeing someone who we diagnosed with Parkinson's disease at the age of 38, okay? So we can still have young onset Parkinson's disease, but the majority of the people that suffer Parkinson's disease are older. And what do you and I think about older people? We think about them as being slow already, okay? So most people will look at an elderly person, he's got a little tremor, he's hunched over, he walks slow, and we automatically conclude and say this is just an old man, when in actual fact, he's suffering from Parkinson's disease. So to me, that's something, I think even in literature, if you look around data that has come from Africa, it's this lack of knowledge of what Parkinson's disease is. We've had patients brought over to us from other facilities where someone has got an eye and they say, you know what, this might be an old person, but actually they are suffering from Parkinson's disease. And the family will actually tell you, we said, oh, we don't know why they asked us to come to you, but this, we just thought that he's getting old, you understand? So Parkinson's disease, yes, it is there are people who suffer from Parkinson's right here in Zambia, across the board. We have younger ones, but the majority are mostly elderly, just like what the information from high-income countries, the developing countries have observed. That is a condition that affects mostly older people. And I think that's where the issue is. We here in Africa tend to think that, this person is just, aging. So this is part of aging, and yet it's a disease. I think that's what I would say. I don't know if Dr. Mataa would want to say something.
Yeah, just to agree with you. I think it's one of those things where the challenge with working in countries like ours is it's not that these conditions are not there. They are there. Part of it has just been we have not been able to diagnose in the past because we didn't know a lot about them. And I think even in the sector, there's always the thought that these are not conditions that we see, but we know better now.
Yeah.
And even when you talk about statistics like it affects 1 in 1,000 people, it might sound like it's rare, but if you are that 1 in the 1,000, then for you that is very significant, not just for you, but for your family as well, because conditions like Parkinson's, especially because they're such a chronic condition, the impact they have on families is quite prolonged. And a lot of the times, so I think in my experience, there have been two sides to the coin. Either the Parkinson's is completely missed and someone doesn't enter the healthcare system at all, or family members, maybe even patients themselves recognize is something that should not be happening. The diagnosis is never really for all sorts of things. They've been treated with mental illness, which brings me to my next question. Sometimes that to make the diagnosis of Parkinson's is going to involve a lot of tests, a lot of very expensive tests that they can't afford. As a neurologist in your practice, when you are making a diagnosis of Parkinson's, what is the process to actually get to a diagnosis of Parkinson's? Are there a lot of tests, or is it more of a clinical diagnosis based on what you find when you talk to the patient and the examination that you do with the patient and the family?
Yes. Yeah, so the diagnosis is clinical, and this is not just in Zambia. All across the world, when we come to making a diagnosis of Parkinson's disease, it's mostly clinical. Yes, there are a few tests that you might be able to do, like a brain scan, but those are very specific for particular situations. Like maybe you are thinking there could be another aspect to this, or you are not able to decide whether this is Parkinson's disease or this is something that looks like Parkinson's disease. But the majority of the time, the diagnosis for Parkinson's disease is clinical. So like you stated, Dr. Mataa, we will listen to the history. Remember those things I talked about, what we call the prodrome, things that they will endorse, yeah, this person acts out their dreams. Yeah, this person, his voice has been becoming smaller and smaller over the years. His facial expressions are not as, they used to be. You might even ask them to bring a picture or a video from some time back and then compare. And then you examine them, of course. So if all of the things fit into what the Parkinson's disease profile looks like, then we're good to go and make a decision that this person perhaps is suffering from Parkinson's disease and is suffering from Parkinson's disease. We don't even query to say, a few times we might not be very certain, but for the most part, we are able to diagnose Parkinson's disease just based on history and the clinical exam. And then from there, we answer the patient, talk about treatment options, and so on. If there's need for other investigations, we go ahead and do them. But by and large, Parkinson's disease is, the diagnosis is made clinically.
Okay. You mentioned treatment, Dr. Chishimba. Can we actually treat Parkinson's? And if we can, how do we actually treat it?
Yeah, so unfortunately, we don't have a cure. There's no cure even out in the high-income countries, the developed world. Treatments, finding a treatment has been very elusive. They continue to do research, but we really don't have a treatment. What we do have, and is how we approach treatment, or something like treatment for Parkinson's disease, is like two things. So we could give you some tablets, which are supposed to be for symptomatic relief. So one of the major treatments for that's the tablets that you might take is the replacement of that chemical which I was talking about, the dopamine, which is responsible for making
the dopamine.
the basal ganglia to function normally. So that's what is lost in someone who's got Parkinson's disease. So there is a treatment that contains that compound, and we can give people with Parkinson's disease, and a lot of them are very grateful. It makes them much faster. It really improves their symptoms, especially the slowing. They freeze when they're trying to walk. They have a freezing of the gait. They're trying to move. It's like the foot is stuck to the ground. So they'll report back and say things are better. They have trouble turning in bed because they're so slow, they can't move over. They will report that, there's a tremendous improvement once they start that therapy. And usually that's another way that we confirm the diagnosis of Parkinson's disease. And then there are other sort of helping agents that we can give to support the dopamine replacement therapy. We don't normally have them readily available in our country, but when we can, we do use them. So they can work together with the main one, the replacement therapy. And then other than that, we can also, because Parkinson's disease, like we have talked about, has all these other facets which have to do with other things. So like we can give you something for the constipation to relieve that. If you're having problems with saliva, because that's another thing, because of the slowing of the tongue in the mouth, sometimes they drool. We can recommend something for that. They might have BPs which are up and down. We might give you something to control that. They might have issues with urination. We might give you something to control that. So in a nutshell, there is some replacement therapy, the dopamine replacement therapy, which really improves the symptoms. But I must say that this is treatment that is given long-term. And depending on how someone is responding, we might require to increase the dosing as the years go by. But as we are increasing the dosing, we also have to be mindful of the potential side effects. We now start to enter into those areas where we might cause side effects. So we always have to do like a strike a balance. But it's a condition that continues to progress. And so you find that for a lot of people, we have to continue increasing the dosing. So that's what I can call the tablet pharmacologic therapy. We also have what we call non-pharmacologic therapy. This is where we use things not to do with tablets. So physiotherapy is very key. Exercise is very key. It helps with the movements of the joints. In fact, this past Parkinson's World Day on the 11th of April, one of the things they were looking at was tips in how to help someone with Parkinson's disease. And one of the things that came out was exercise. So it helps with mobility. Remember, we're talking about someone whose movements are slowed, someone who is rigid. So with continued exercise, what works for you, you really can improve someone's livelihood. And many other things that we might recommend that don't have to do with taking a pill, taking a tablet. We will give that to the patient. Some persons with Parkinson's disease will, over time, start to develop maybe some psychiatric symptoms or depression, like depression, for example. You can give tablets, but you can also offer other therapy that doesn't have to do with tablets. So there are all these angles that we can take in managing someone with Parkinson's disease. We're also mindful of the fact that the people that look after persons with Parkinson's disease can also have their own challenges just because they have to look after someone who has Parkinson's disease. So we try to manage those people in a different, of course, not giving them tablets, but we try to engage them, give them tips, train them, help them manage the patient, especially imagine someone who is failing to stand up on their own because of rigidity, failing to turn in the bed because of rigidity, so that takes a toll on even the caregivers. And so, especially in developed settings, there's facilities that help the people with Parkinson's disease, but also offer some sort of help to people that are looking after these people. They do have facilities where you can take the person with Parkinson's disease when they start to deteriorate in a certain way. Yeah, that's what I would say about treatment.
Lorraine, you've just, I don't know if you know, but you have just wonderfully explained my area of interest. So my area of interest is
exactly.
Neuropalliative care. And what you've just done is describe a wonderful approach to how we should be taking care of people with conditions like Parkinson's and anything else that really is life limiting. Where, like in Parkinson's, where we don't have a cure, but we do have medications that we can use for symptom management to improve quality of life. But we don't end there. We look at everything about the person. So the physical part is just one aspect. We have to do medication, of course, when medication is available, but there are other things that we can do, which you've described wonderfully. And also the other aspects, the social, the spiritual, and the emotional aspects, not just for the patient, but for the family as well. Like you said, this is a condition that is chronic. It may take 10 years for symptoms to manifest, but people with Parkinson's can live for many, many, many years with these symptoms, and the symptoms get worse with time, which can be very distressing for the patient, very distressing for the caregivers as well. So it's very important that we look holistically in a palliative care approach, especially towards the end of life for patients with Parkinson's. So thank you for bringing palliative care to the table. I'm always happy to talk about palliative care. You know me.
Yeah. We know our palliative care specialist. All right.
Great. Zanga, I don't know if we have were there any other questions that people put forward for us to try to tackle in the last few minutes before we come to a close?
I think it has been tackled. It was the fact about is there treatment for it? I think that was one question.
Right.
We always ask this question. We know with our family members who are in rural areas, those who've got PhDs in herbal medication, and I know majority of them would try to use herbal medication. What would be your advice? I know you've touched on it, and I don't want Dr. Mataa to talk about palliative care and how to take care of patients because it will be another 30 minutes. So as we conclude, maybe again touch about the treatment, self-treatment, herbal medication, and how do we, if we come to the hospital and we're found to say my uncle who's 65 has now got Parkinson, what next for us? What are we supposed to do as we conclude?
That's a good question. It's true, especially in our setup. I think even in many other societies, there's always the non-conventional consideration. I'm not an expert in that area, so I'm not quite familiar with some of the herbal medications that can be of use.
No,
There's
none.
been this herb. No. I'm still, not that there's none. So I think it's in India. I would need to check this. So there's a there's a plant called Mucuna pruriens. I don't know what it's called locally. It's something that has been used in Ayurvedic medicine for people who exhibit Parkinson's disease. Like they have used it for thousands of years in the past, and they used it for people who looked that they had Parkinson's disease, you know what I mean? And so there's been research in that area to try and see if this particular plant, they could extract something and create a drug that can help people with Parkinson's disease. To be honest with you, I don't know how that is used. Those who know the plants know how to use it. I wouldn't want to then say all those with Parkinson's disease go and look for this plant and use it. It's just that you've asked the question. So there might be herbs out there that may, improve the symptoms for people with Parkinson's disease. But what I'm trained to do is to provide the conventional medication. So I will ask you to come to our facility and we can give you these drugs that we know work, like the Cinnamate. I think most of the people know the name of that drug that I was talking about called Cinnamate. That we will give it to you. We may not have it in our facilities, but we have ways in which we can assist you to acquire that drug if you are diagnosed with Parkinson's disease. So if there are people who have herbs or means, I'm not an expert, I can't really say, oh, don't do this. People are free to do as they would like. But of course, we always caution people to be careful what they ingest, to know what they're taking in, because some of these things come with a lot of side effects, which you may not know about, and they will, make your liver go damaged or your kidneys get damaged. But with drugs that we are conventional, we know what the side effects are. I can tell you that, when you take it like this is what I expect, and this is how I can sort your problems out. So I think that's what I would say on that angle. What was the other part again? I don't know if I left out.
What would be your advice? Yeah.
Oh, the advice. So I would ask that they come through, so that I think what's important is to know what your condition is. When you know what your condition is, then we can tell you how to look after yourself and how the rest of the family can look after you and how they can manage to look after you. So they should be able to come through so that a diagnosis is made. I think that's important. That's what I would recommend. We didn't have a lot of specialists. We are privileged. We have a training program for neurologists currently running. And so we are getting equipped to identify these conditions as a country. So people should not hesitate to seek help to try and find out if indeed they are suffering from Parkinson's disease or any other neurologic condition for that matter. I think that's what I would recommend. I don't know what. Mataa, you have something you might want to add? I'm the one who's giving you tips of asking you questions or what to add.
No, it's good to be on the other side and getting interviewed for a change.
Hey.
No, I agree. I think it's just getting into. We all know that old age and old age gets blamed for a lot of things, and there are things we know that are normal part of the aging process, but there are also a lot of things that are attributed to old age. It's the same with Parkinson's disease. It's the same with conditions like dementia. So even as people get older, yes, we expect certain things to happen, but when we see that dad, mom, grandma, grandpa, something is changing, I think we should get into the habit of going to health facilities and being seen by health professionals. And then hopefully the health professionals, as we all continue to learn, will be able to pick up, okay, this is part of normal aging, but this shaking, this slowing is not part of normal aging. And let me get this person to the next level of care so that we can get a proper diagnosis about what this is. I think this is Parkinson's. Let me send them to see a neurologist, and then hopefully they can get treatment for that. And we emphasize this because we have seen both of us, Lorraine, yourself, even Zanga, who's on the pharmacy side and helps us access these medications. We have seen the impact of getting a diagnosis and getting treatment for Parkinson's has on quality of life. Someone who couldn't walk on their own, suddenly after a few months of treatment, they're now independent. Yes, they're elderly, but they're independent. The shaking is gone. They're walking on their own. They're not falling. And that it's small things like that, but in terms of quality of life, it's very, very significant. So get to a hospital, get to a clinic, see a healthcare provider, and then get the diagnosis and the treatment.
Exactly.
Zanga, over to you.
Yeah, I've enjoyed being in the background. Dr. Chishimba, thank you very much.
Thank you, Zanga.
Yeah, thank you very. Oh, I'm now on. Yeah, thank you very much. We've really enjoyed. I've enjoyed listening. It reminds me of school again. We always ask one question. I don't know if Dr. Mataa tipped you or not, but there's always one question that we do ask people that come on our platform. So I don't know if you're ready for it.
I don't know if I'm ready for it.
All right, so
okay, fire away. I'll see what I can do.
Dr. Chishimba, on your phone, do you have the Medsearch Zambia app? Have you downloaded it?
Not yet, but I subscribed. I'm on it right now. Okay, that wasn't too difficult.
Thank you very much. To everyone who joined us on Facebook, we want to appreciate Dr. Chishimba for according us her family time to be on our platform and learn more about Parkinson. Dr. Moses Mataa, thank you very much. My co-founder of Medsearch Zambia. Medsearch Zambia, like we always say, is a medical directory application that we developed that is helping people find a registered health facility where you're able to go to and get help. It's not every health facility that you hear being recommended by people in the community that you're able to go to. You'll be given wrong medication and the condition will worsen. So this is why we encourage you who's watching, download the application on your phone. It's free of charge. The app is both on Android and iOS. Why we did this is to make access to health information and health services as easy as possible for everyone. Me and Dr. Mataa would always receive phone calls. I'm looking for this medication. I'm looking for a cardiologist. I'm looking for a neurologist now. Do you know any? Can you recommend me? So with the Medsearch Zambia app, you do not need a middleman to help you find a drug. The app becomes the middle person to help you. Here at Medsearch Zambia, we always say Medsearch Zambia, healthcare simplified. Till next week.
Medsearch Zambia app, healthcare simplified.